reports say there are over 1,000 infections and with about 150 deaths total.
Yeah, why we are afraid is that this new virus is the first of its type in history. Usually we have this mixture of the viruses, or what we call the assortment of two different viruses. But this one we have three viruses, two human viruses, even viruses, and one swine virus mixing together, even mixing in this swine. So it's killing very fast. And what is strange again about this epidemic is that, it's killing, the previous ones usually killed the weak, either the old people or people with chronic disease or young children. But this one is killing young adults. So from the time it's reported in Mexico, and the way it is been it is transmitted now, yesterday if you ask me, I would say it's 82 or 86. Today already they are reporting 152. And the fear is that when the human-to-human transmission is sustained, then the world is in trouble. The world is in serious trouble. That's why you can see that many countries are really increasing their alert level. In fact, the committee of the World Health Organization met yesterday on this, and the committee is to advise the Director General on the next steps to do, what steps to take. That committee has now recommended that we should increase the world alert level from phase 3 to phase 4. To understand, for the common people to understand, is like if you go to the traffic light, you see the red light, then red light changes to amber, and amber to green. So the world, the experts, face this pandemic, possible pandemic, to those three type of things. So phase 1 to 3. Up to 4 is, to 3 is that red light, when all countries should stop and start planning and fine-tune all their plans to respond to the outbreak. Then the phase 4, to 5, by the time it's going to 5, you are now in the amber light, when the epidemic is about to explode. So by the time we reach phase 4, 5, and 6, the entire world will be in trouble.
And what is our own level of preparedness vis-a-vis diagnostic capacity?
Well, I have to reiterate what the Honorable Minister of Health said yesterday at this briefing. Nigeria, want to reassure Nigerians that we have the capability, to carry out the diagnostics. We have a very sophisticated laboratory at Asokoro, which has passed international proficiency tests. We gained 100%. We have not missed any human case, and we are assuring Nigerians that we have the capability to do diagnosis here locally. Secondly, for the past 3 years, Nigerian government has actually been funding through a budget allocation and the World Bank special funds a group called Steering Committee on Avian Influenza, which is co-chaired by the Minister of Health and Minister of Agric. And then that group is meeting virtually every fortnight, and we have been preparing for the past 3 years the country on how to respond to this pandemic. So Nigeria is really, doing well. In that group, you have Minister of Agri, Minister of Health, and Minister of Information and Communication. We have enough materials to start, at least the initial response. Yesterday, the smaller group, which is headed by the directors in the 3 ministries, met with all partners, WHO, UNICEF, UNDP, FAO, all of us. We met yesterday, USAID, CDC, to chart the way forward for this response. We are meeting again today, 2:30, to come out with what to do immediately. But I wish to advise, if I can continue, that the alert information. I'm supposed to have come here with information expert, but they are busy actually trying to design the best response. So we want to seek for Nigeria, collaboration of Nigerians, especially those coming from USA and Mexico, to please report to any medical center where they will have, if in case they have any symptoms like fever, running nose, difficulties to breathe, and in most distant diarrhea, they should report immediately to any medical center. And we have also advised all medical centers to report to our Federal Epidemiological Division and the center. We have Special Crisis Management Center. The numbers will be given, very soon.
Okay, thank you, Dr. Abdulsalam Nasidi, Head Technical Group of the National Response to Swine Flu.
It's avian influenza.
And that's it on Panorama for today. We thank you for your time. We're back again at 4 for Nationwide.